Hello, everyone, and welcome to The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication.
And I'm Jeremy Fallis, also with the Department of Communication. Today, we are going to touch on the important topic of suicide and the incredible work our team members are doing to address it in the pediatric population.
Now, before we get into that, be sure you go back and get caught up on any episode of The Wrap you may have missed, including last week's that previewed the upcoming Quality Month celebration at Michigan Medicine. You can find that show and many more on your favorite podcast hosting platform, the Michigan Medicine YouTube channel, or as part of the Headlines Week in Review every Friday.
With that, let's bring in Dr. Nasu Mallas and Corey Ziegman, who are part of the Zero Suicide Initiative at CS Mott Children's Hospital. First, let's have the two of you introduce yourselves and explain your roles here at the organization.
Hello, Jeremy and Daniel. I'm Corey Ziegman. I'm the Associate Chief Nursing Officer for CS Mott Children's Hospital. In that role, I oversee our 4 general care units, 3 ICUs, and our child psych unit.
Hi, my name is Dr. Nasu Mallas. I serve as the Associate Chair for Child Psychiatry in the Department of Psychiatry, and also as a member of the Zero Suicide Lead team at CS Mott Children's Hospital.
Great. Well, thank you both for joining us today. Now, for those who may not be aware, can you discuss sort of how significant an issue suicide is in youth and what can be done to address that risk?
So that's an excellent question, Daniel. Over the past decade, we've seen a pretty dramatic rise in pediatric mental health. And that rise has been seen in our ambulatory clinics. It's been seen in our emergency room, in our hospital. And part of that rise has been the rise, unfortunately, in pediatric youth suicide. Over the past decade, we've seen a 60% increase in the rate of youth suicide. There are a few studies that have highlighted some of the increases. One study looking at the number of ED visits for youth ages 5 through 18, showing a 153% increase in youth suicide presentations to the ED environment. We've also seen the number of mental health inpatient admissions rise by about 40% among youth with suicide risk. And what's problematic about this, just on the surface, obviously, with youth attempting suicide and presenting with suicidal risk being a concern, we also know that when youth present with that risk, they're at 20-fold higher risk of dying by suicide at some time in their life, as well as 6 times higher risk of reattempting later in adolescence or young adulthood. So this is a real challenge for us, not only at the Children's Hospital, but in our health system at large. We know that about 20% of high school students seriously consider suicide during their time in high school, and that 1 out of 11, this was really shocking for me to hear, but 1 out of 11 youth have endorsed attempting suicide in the past year. So we have a real opportunity here at the Children's Hospital to address this risk of suicide. We know that the vast majority of youth that present with suicidal risk actually present in the medical setting. About 83% of youth who present to medical areas, ambulatory, ED, or hospital, that's the last time they presented to a healthcare provider before they die by suicide. The vast majority are presenting to medical settings, not mental health settings, with only about 30% of youth with suicidal risk actually going to seek mental health care. So we actually have a real opportunity as a collective community at Michigan Medicine, at Mott, across all of our care services to identify this risk and come together to address it.
Let's dive in a little bit deeper into how Mott itself is addressing the risk of suicide in youth. What are some of the initiatives, the programs that you are rolling out, and how has it been impactful in the community?
So I'm newer to the Zero Suicide Steering Committee. Nasu and the team asked me to join in April. And I will say that from a Mott perspective, this has been an incredible learning journey for me. As a mother and as someone who raised kids in the school system, I, certainly saw the breadth and levity of the impact that suicide has on kids in our school systems and what is happening in our communities. And I was beginning to see it in my role here at Mott, whether it's, looking at patients that came in through the ER for suicide attempts and the impact on what Nasu was talking about, the mental health patients that are admitted to our medical units. And so Nasu can speak to the specifics of what Mott is doing because he's been been part of this for a very long time. However, I will say that my role has been to really make sure that we are putting these on the map and to support the efforts of this team as a whole. It is something important in our efforts to improve community health and the wellness of our pediatric patient populations. The patients that are attempting suicide are much younger than what we have historically thought of. And so this is, a crisis across not only our local community, but across the nation.
And if I can add to that, first of all, Corey, thank you for sharing your lived experience of being such an active partner in this and an advocate in this work. When we first embarked on a more holistic, comprehensive suicide prevention program at Mott Children's, we actually thought we were doing a great job. And we do have a lot of great work happening, but I think our engagement in the national zero suicide movement has really opened our eyes to how much more we could be doing to support youth and families and made us much more critical of every aspect of the care experience from the time you interact with Michigan Medicine to the transitions in care between different settings. We actually leaned into this work fortuitously through our Chief Operating Officer, Luann Ewald, really promoting and advocating for us to be a part of a collaborative of 16 hospitals, children's hospitals across the country back in 2022. And that was part of something called the Zero Suicide Initiative. Zero suicide meaning the aspirational goal that we try to mitigate suicide risk wherever we see it. We recognize suicide is a very complex issue with many factors contributing. And we know, unfortunately, suicides occur. We reflected on some of the statistics earlier. But the way that we address suicide needs to be the same vigor and energy and collaboration that we address issues like myocardial infarctions or strokes or other healthcare issues that have significant risk of morbidity or mortality. What's alarming when you see the stats is that suicide is the second leading cause of death in youth ages 10 to 24, a large population that Mott and many children's hospitals serve. And so for us to really scrutinize and think about every single part of our process, identify and surface that risk, help train and empower our staff, as well as conduct thoughtful risk assessment when screening results are positive, and provide good management plans that are coordinated across our system, we really need to have that aspirational goal of trying to get to zero, knowing that that is a challenge, but it's a challenge we're willing to take up together. So that's what we leaned into, and a lot of our work has been focused on the entire continuum, from engagement with our leadership that's been tremendously supportive at Mott, our other leaders in regulatory, nursing, physician leadership, social work. We've had a lot of lived experience. So families that have been impacted by suicide are informing our process, and we're thinking about screening, risk assessment, management, follow-up calls, all the different components that we would consider in terms of supporting youth and families that may have risk of suicide.
So you mentioned the beginning of this initiative back in 2022. Can you take us back to that time a couple years ago? What did launching the Zero Suicide Initiative entail? What was that like? We've heard Corey mentioned a steering committee and project leads and all sorts of things. So what did the beginning of this initiative sort of look like on the ground?
It's been quite an interesting journey, and I've been very privileged to work with wonderful people like Corey and many of the folks on our lead team, steering committees, and leadership and staff across Michigan Medicine and Mott Children's Hospital. We leaned into this not really knowing what we were really expecting to do exactly. We had a vision for what we wanted to achieve, and it was pretty clear as we started to assess current state that there was a lot of work to do that we didn't anticipate. So one of the foundational activities that we did early on in the process is we attended a national conference to really understand what the Zero Suicide Framework entailed and really understand the processes that we needed to employ to really holistically and comprehensively assess and modify our suicide prevention strategy. From there, we did something called an organizational self-study, where the Zero Suicide Institute and the Children's Hospital Association has essentially a grade book, a series of metrics that you can grade your system on in terms of whether or not it's really achieving the goals of the Zero Suicide Initiative. And so we went through and engaged various stakeholders to grade ourselves on the 7 elements of the Zero Suicide Framework. Many of the elements that I described already around training, leadership, engagement, transitions and improvement of our process, as well as screening, risk assessment, and management. And what we found was we were strong in some areas, but there were a lot of gaps. But surfacing those gaps, I believe, may have been one of the first times we've really done that at a systems level and engaged such a wide stakeholder group. And by pursuing the Zero Suicide Initiative, it inherently created an oversight committee, which we call the lead team, as well as a broad stakeholder group, which we call the steering committee, that meets every other month to really reflect on initiatives and activities from several working groups. We also created a listserv to help inform folks of opportunities to engage in national conferences, regional and local presentations, to pursue trainings, and to engage in networking and dialogue around this important issue. And so through that process, we've been systematically reviewing areas of opportunity, looking at feasibility, sustainability, and impact. Largely right now, we're focusing on the screening process and really enhancing that process and connecting across our care continuum around screening, as well as looking at how we can create improved training opportunities to really empower our staff to do this work. And also have done a lot of work around post-discharge follow-up calls to really connect with families during transitions of care to make sure they're doing okay, their child is safe, and if not, how can we support them to mitigate risk of worsening of their condition or a bad outcome. There is so much more that we need to do, but we're really working with everybody to ensure that we are identifying the right information, sharing that information effectively, and then creating priorities that are meaningful to everyone.
And with that, you have so many different elements that go into it, right? So I'm just curious. You've been doing this now for 2 years. What are you hoping to do in the future to build upon all the great work that you've already started and get the most out of it and make sure that the risk continues to decrease?
I think if I may jump in just to speak from a nursing perspective, certainly as I see that key portion of my role, one of the things in the information that Nasu had shared with me when joining the group was that gap analysis and some of the issues. And what we're seeing is a decreased awareness of our staff at large across all of the units of how big of an issue this is, because they only see the medical portion of it when a patient comes in with an ingestion. And so, I see this group, and some of the work that we need to do moving forward is really increasing the amount of communication about Zeroside and the impact to this in our community and even healthcare systems at large. And so, pieces of that are, how do we integrate elements of the electronic medical records so that we're documenting and we're doing screening? And as a pediatric hospital, changing some of the age levels at which we're screening some of those patients, which is a difficult conversation to have. And it's hard to say, we need to move to screening a 9-year-old or a 10-year-old. We think about ourselves when we were 9 or 10, and maybe we were riding our bikes and playing Barbies, and the thought of ever having contemplated suicide might be hard for us, but there are youth out there that are significantly struggling. And so I see a huge initiative is really getting the awareness out there and improving communication and making it not a taboo subject to even talk about. I think we're hesitant to talk about suicide in children.
I would echo what Corey stated. We have a lot of opportunity here. I think we do fantastic work. We have a lot of the important pieces, and I think we're building off of a very, very strong foundation. What's exciting is we actually just secured some additional funding through the state to expand our efforts and build a bigger team. And so we have more capacity to continue this work and broaden the mission. One thing that's been really exciting is we have a data dashboard that now allows us to surface key indicators of suicide risk and process outcomes. So what are we doing when that risk is identified to really support not only patients and families, but our other care team members that need to become aware of this and need to manage that need for the patient and family. One of the really, really critical steps in that is to ensure that we are infusing the evidence base in our practice and creating consistency so that if you present on a Saturday evening in the middle of the winter versus on a Tuesday afternoon in the middle of the summer, you're getting the same quality of care, the same type of assessment and management, and that we're connecting you to the right resources and also managing that risk over time. The risk management doesn't stop in the ER. It doesn't stop in the hospital. It's not just an ambulatory issue. It's everybody's responsibility. And I think we're really hoping over time to build a culture where folks are really energized and engaged and fully kind of aware and supported through training to do this work in that vision where it's really done collectively across not only all of our service lines, but across time too, because that risk certainly evolves over time.
Corey, I liked how, one thing that you mentioned was improving the communication about this. And I think that, this podcast is just one way to do that, right? Is to get the word out about the initiative, but also to just raise awareness in the community. And I wonder, and maybe this isn't the right platform to ask this, but I do know that so many of our employees and listeners, are either parents or aunts and uncles or coaches or teachers in the community, neighbors, interact with kids all the time. Are there sort of some warning signs that people can look out for that can help them be stewards in the community toward helping mitigate this risk?
I think Nasu can definitely speak to the nuances of the things to look for. However, I feel it's paramount as a health system that we are reaching and leaning into our communities. That's one of our pillars as Michigan Medicine is supporting our community and providing things. And just like we provide immunization clinics or we reach out for food drives and things like that, very important initiatives, but so is reaching out to all of those groups you just named to talk about zero suicide. And again, lifting that veil and that taboo subject of talking about suicide and equipping our community with the needs and the resources to be able to speak to these things, identify these challenges, and support these at-risk youth. Now, Sue, I'll turn it to you for the specifics, because that's certainly, as a psychiatrist, that's your clinical background, more so than mine.
Yeah, no, I echo what you stated, Corey, and we have readily identifiable warning signs. We know some of the risks, but as I stated earlier, suicide is a very, very complex issue that really requires us all to be engaged. That's not only families, it's schools, primary care, the emergency room, specialty practices. I was talking to a cardiologist recently about the fact that sometimes we don't recognize that specialty pediatrics and working with a cardiologist, a GI physician, a neurologist is an opportunity to screen for suicide and to have that conversation. We know that chronic physical health issues increase your risk of suicide by 3 to 4-fold. So I think first and foremost, it's awareness, being aware that this is an issue, this is a risk. Parents often have a very good sense of when something is off about their child, and we often leverage that wisdom to help us understand what are they noticing. Maybe it's isolating more, or dropping activities that they typically enjoyed, or reducing relationships, or maybe becoming more irritable, more argumentation at school or at home. Recognizing those changes in behavior, in emotion and affect, and in interpersonal engagement can be a sign of possibly someone who's starting to have thoughts of suicide, or maybe a concurrent mental health condition that has higher risk for suicide, like depression or anxiety. So being mindful of that. A lot of times sleep can be a really important proxy. If there's significant sleep disturbance, that can sometimes not only be a harbinger for mental illness, but also could put you at higher risk of considering suicide or attempting suicide. Things that are more kind of proximal to suicide risk, obviously, if somebody's verbalizing not wanting to be alive, if they're verbalizing a desire to harm or kill themselves, that certainly should be taken seriously and thoughtfully, not in a way that maybe shuts down the adolescent, where you have a judgmental tone or an accusatory tone, but more validating how difficult things are at in their life, recognizing or calling out, I noticed you're not, playing sports as much, or you stopped talking to so-and-so. I'm wondering what's going on. Are you feeling safe? And then, it's okay to ask. As professionals, it's okay to ask. We're not inserting the idea of suicide when we ask about it. That's a common misconception. In fact, many folks who have had suicidal risk say, if only somebody asked me, maybe I could have felt better, or maybe prevented an attempt from occurring. And so it's really important to have those fora, to have a trusting, safe conversation. And sometimes screening is less about the screening and more about creating a safe conversation. And that's what part of what we're doing with Zero Suicide is, hoping to create some educational resources to supplement that conversation. Things also that we get concerned about are when youth are starting to give up items that are cherished to them, saying goodbyes, writing text messages to friends indicating that they don't want to be around anymore. Sometimes we see self-injurious behavior, like cutting behaviors, as potentially a preparatory activity, although there are a variety of factors that contribute to cutting. But I think fundamentally it's recognizing the changes in relationships, behaviors, emotions that you may be seeing in a child, and working collectively with the school primary care, and other trusted adults in that child's life to understand what's contributing and having those candid conversations about suicide when it becomes apparent that that may be a risk.
I think those are all such wonderful notes to keep in mind, because folks who aren't in this space, they just sometimes aren't aware or maybe oblivious or aren't, part of something that might be serious. And, for the most part, everybody wants to help, right? So I guess this leads into my final question for you both is, if we have lots of listeners who do want to help, they want to participate, how can they contribute to the Zero Suicide Initiative? How can they help and make this better?
So I'm happy to start. I would certainly say we welcome any individuals in our care community at Michigan Medicine, at the Children's Hospital, that are interested. We do have a listserv where we send out announcements, and certainly could add anybody that is really interested in participating in that. We also welcome engagement in working groups and activities. If you have a particular passion for this work, we want to facilitate that. So you're welcome to reach out to Corey and I if you have that interest or passion. Certainly if you have lived experience too, that is a very powerful voice of perspective that we want to elevate. And we can think about that collaboratively in terms of how we honor that perspective and bring that into the work we do. So there are a variety of ways to contribute. And certainly we've gotten support from the Children's Hospital, and actually just recently got support from the Dance Marathon on campus for this work. And so I would just keep tuned for any messaging from our Children's Hospital leadership and from our Dance Marathon colleagues about the work that they're doing in this space. And that may be another avenue to contribute to our overall suicide prevention mission.
And if I may add, I think the biggest thing that our listeners can do is to get informed. Certainly we're sending out information on the listserv, but even if you go to Google and you type in Zero Suicide Initiative, there is a wealth of information out there. Inform yourself, inform your friends and your family and those that you interact with, whether it's your church group or your hockey group or, whatever your after work activities are. I think the biggest and most important thing we can do is inform.
Absolutely. Well, thank you to you both for informing us about the Zero Suicide Initiative. And another way that people will be able to learn, we are going to have a feature story in Headlines at mmheadlines.org. That's mmheadlines.org. So go there to learn even more about the Zero Suicide Initiative.
All right, let's switch gears just a little bit. It is time for our world famous lightning round. This is where we get to ask one of our guests for 4 quick fire questions. Corey, you are the winner today. You are on the spotlight. Are you ready to go?
I'm ready.
All right. Now, this past weekend was officially the first day of autumn. What is your favorite fall activity around Michigan?
Ooh, that's a good one. I think my favorite fall activity is football. We are a diehard Michigan football family. And so every Saturday we host a football party at our house with friends and family and whoever is welcome. Sometimes we'll have 10 people. Sometimes we'll have, 40 people just celebrating our Michigan team.
Well, I'll be there on Saturday.
Great.
And I'm assuming before you host that party, you might be eating some pancakes. I don't know if you know that September 26th is National Pancake Day. So this question is, what is your favorite breakfast food?
I'm not a huge breakfast eater, so I'm not great at this. But if I had to choose a breakfast food, it probably would be waffles. I love waffles. Not covered with all sorts of things, just a plain Jane Belgian waffle with some butter and real maple syrup.
Yeah, and you get the syrup in every divot. It's amazing. I'm with you on that.
Absolutely.
Yep. All right. So the Emmy Awards were held recently. What would you say is your favorite TV show?
I'm not a TV watcher.
At all, huh?
Not at all. Like, my husband and I will binge some, Netflix shows that were on TV at one point in time, but really not a TV watcher.
You into movies, podcasts? What are you into?
I like, we'll watch some movies. I will listen to podcasts. I'm ashamed to admit right now that my daughter has me listening to the Morbid podcast, which is all of these historical murder scene things, but it helps disconnect my mind and think about something different.
Now I want to listen to that. That sounds
Be
fascinating.
careful.
Dan is a massive true crime fan, so
Yes.
give him any extra ideas. So finally, who has been your biggest mentor in your career, and what is one important lesson that you learned from them?
I know you primed me ahead of time to answer truthfully, and I would say that my faith is my biggest. It guides my morals and my values. I am a Christian and follow the teachings of Jesus, and as such, I would see that as, the Bible and all of the teachings have been my biggest guide through my life. Certainly, when I look back, there are many people that have impacted me in a positive way. When I think about, high school teacher, when I think about college professors or even work colleagues, but ultimately, when I'm asked that question, I reflect back to my faith.
All right. Well, thank you so much, Corey, for playing along and sharing your insight and your personal perspectives. And of course, your insight into the Zero Suicide Initiative here at Mott. If you want to learn more about the important program, go to mmheadlines.org. That's mmheadlines.org.
All right, Dan, we asked Corey about her favorite breakfast foods. You already gave us a little insight, but What are you doing for your first meal of the day?
Yeah, so I'm actually very similar to what Corey said. I'm not a big breakfast person. I will forget to eat breakfast all the time, and it just sort of is what it is. But if I go out to breakfast with somebody, it's either going to be a waffle, like she mentioned, or French toast. Those are really the only two things that are probably going to be ordered by me if I go out to breakfast. What about you?
I mean, I do love breakfast. Obviously, there usually just isn't enough time to make it in the morning, especially Monday through Friday, getting the kids ready and go to school and stuff. But if you're going to go out for a brunch or something like that, I'm going to go with a waffle, but I'm not going to just have the plain Jane's, syrup and butter. I want something on it. I want some chicken. I want some hot sauce. I like chicken and waffles a lot.
Okay.
And I like having some eggs on the side. So something, a little bit of starch, a little bit of protein, a little bit of sweet, something spicy with it, put it all together, and that's a pretty good breakfast.
I remember when I was a kid, we would get steak and eggs. My mom and I, she would eat the eggs, I would eat the steak. And I'm like, hey, that's a great breakfast. You're going all out.
It's good. And breakfast for dinner is okay too. I mean, I enjoy a good breakfast for dinner every once in a while. So if you can't get it during the week, in the morning, you can get it for dinner.
Nice. All right, it's time for the weekly trivia contest. This week's question is, U of M Health has stepped in to help patients impacted by which pharmacy closures? Once again, U of M Health has stepped in to help patients impacted by which pharmacy closures? You can find the answer in headlines, and once you know it, send it to headlines@med.umich.edu for the chance to win a prize.
Hope people come up with the right answer for that one.
Oh, I see what you did there.
That's all we have for today. Thank you, Corey and Nasu, for joining us. And thanks as always to our listeners and viewers for everything that you do for our patients, families, and each other. We'll see you next time.